Welcome to the CT module of this series, which is titled Image Evaluation and Archiving. In this model, we will learn and understand what factors can influence image evaluation in CT and how to archive images for future retrieval. We will also cover known best practices that can minimize artifacts, and we will look at an image to see what some artifacts look like on an image. So let's begin the module. So we have a number of objectives, and after completing this module, hopefully you will be able to name the common controls that are found on a CT operator console and describe why and how each is used. We will look at the factors that can affect image quality in CT, such as spatial resolution, contrast resolution, and noise. We will discuss the various types of image artifacts and explain how CT artifacts can be reduced or totally eliminated. We will look at various ways to discuss archiving images, and we will discuss the use of teleradiology for remote imaging centers to transmit and to receive images. So let's begin. This outline lists all the areas that we will examine in this module. These areas have an impact on the image display. Understanding these will help you understand whether an image is of good quality or not. So let's start by looking at pixels and voxels and their effect, and then we will move along to the other qualities. CT scanners create digital images that consist of a square matrix of elements that are known as pixels. Each pixel represents a voxel, or voxel element of the tissue of a patient. As a rule of thumb, a CT image should have about as many pixels in each dimension as there are detector channels providing data for a view. For example, a 10 by 24 channel linear detector array justifies using a 10 by 24 times 10 by 24 pixel reconstructed image. Pixel size is inversely related to detail. The smaller the pixel, the better the image. As the pixel size gets larger, noise will increase and contrast resolution will decrease. Again, it's important to remember, the smaller the pixel size, the better the detail. Voxels, on the other hand, are fairly complicated to understand, but can be defined in the easiest of language as a volumetric pixel. We can define a voxel as a value on a grid or matrix in a three-dimensional space, like a pixel with volume. Each voxel contains certain volumetric information, which helps to create a three-dimensional object. This slice shows us pixels and voxels in a CT scan image. As for matrix size, 512 by 512 has been used in conventional CT, but larger matrix sizes such as 1024 by 1024 and 2048 by 2048 are available with ultra-high resolution CT, otherwise referred to as U-HRCT. According to a new study that was recently published in Academic Radiology, in ultra-high resolution computed tomography, a large matrix size maintains the spatial resolution and improves the image quality and the assessment of lung diseases when compared to a 512 matrix size. If you look at these